Hi, I'm Becca Kennedy,
And I'm Howard Schubiner.
and this is The Science Behind the Symptoms, where together we will explore the new science of neuroplasticity through a lens of curiosity.
And we are a podcast of the Association for the Treatment of Neuroplastic Symptoms. Today, what are we doing today, Becca?
We are exploring, this is episode 6, and we are exploring POTS with Chelsea. And we are going to dive into her experience and look at the science and how all of this can make sense.
And of course, POTS is postural orthostatic tachycardia syndrome, which basically means postural means standing, what position you're in. Orthostatic, well, postural is what position you're in. Orthostatic is standing up. Tachycardia means fast heart rate, and syndromes mean we don't know what causes it.
That's okay. Actually, it's pretty true. Yeah.
There you go. Okay.
Yeah.
I just wanted to make that very clear.
Yeah, exactly. And the sort of the definition of POTS, of how we diagnose it, is that it's defined by a significant heart rate increase. So our heart rate increases greater than or equal to 30 beats per minute within 10 minutes of an upright posture or standing up, but no drop in the blood pressure.
Right, which is really significant. And we'll talk about that more. But when you faint, I mean, I'm a fainter. I don't know about you guys, but I faint. I'm really good at
That doesn't
fainting.
surprise me, Howard.
But when someone faints, their blood pressure drops, their heart rate drops, and their blood pressure drops. Both can be very low, and that's why you pass out. And I won't bore you with all the different stories of the times I fainted. Maybe we should move to Chelsea before we get into that.
Good diversion technique.
Yeah.
Well, yeah, Chelsea, welcome. And we're excited to have you here. Thanks for sharing your story and tell us about it.
Yeah, thank you so much for having me on. My name is Chelsea Angelella, and I suffered for a very long time before I found true healing, long-term relief. It was a lifelong battle for me. It was one thing after another, basically since I was born. I was always in the doctor's office. I was always sick. I always caught every bug that came around the school. I started having the allergies and headaches and growing pains is what I was always told I was experiencing, and it was never ending. It was the strep throat. I started having migraines. I didn't realize that's what it was at the time, but eventually I understood what that was. I started seeing specialists at a really young age. In my childhood, I saw a neurologist. I think I was maybe 12 the first time, and I started getting prescribed medications. First, it was for the allergies, and I was on a ton of medications. I can't believe I was put on so many medications at such a young age. I mean, I was probably on 10 medications as a child, and it was
Gosh.
just never ending. And then, I went through my puberty years and started having female related symptoms. I was diagnosed with endometriosis. I was having ovarian cyst bursts. I had all the things, and I was diagnosed with migraines and central pain processing disorder, all in my childhood. And then it turned into fibromyalgia diagnosis, and I got the POTS diagnosis. And even after POTS, I continued to be diagnosed with a lot of different things. And it's like as soon as I wrapped my mind around something, some diagnosis or some label, and seemingly learned how to live with it, it was a new set of symptoms, and it was
Mm.
constant. And this went on, 30 years of my life, I was
Oh my gosh.
in and out of the doctor.
Wow.
That's horrible. Like, it's also way too complicated. It's like, that is really complicated. I mean, think about, you must have felt like you were some kind of weird alien or something. Like, why do I have all this? Why am
Mhm.
I on all these medications? Am I having all this pain and everything? I
Mhm.
mean, how did you survive even your teen years?
I don't even know. That's a great question. I think a lot of it was I wanted to be a normal kid. I wanted to be a high school athlete. I played
Good.
field hockey, I played lacrosse. I was a really high achiever and I strived to make really good grades. Like I'm the kid who won the freshman algebra award and I was always wanting to do well. And I was also the oldest child. So I also had this, big sister kind of mentality. I wanted to be a role model and
Mhm.
I had a lot of motivation to just live normal life. I didn't want to be sick. Like I really didn't want to, but it was very confusing. It was
Mhm.
always something.
Mhm.
And I felt really lost and confused and alone. Like I remember checking out from school all the time. I was
Mhm.
always missing school. I got
Mhm.
mono my senior year in high school. I missed over a month of school. It was like the worst case they'd ever seen. And it was a lot, but um I didn't know what else to do. It was just
Yeah. Wow. I mean, it's a lot of pressure that you put on yourself, it sounds like, of achieving, getting good grades, being an athlete, being probably over responsible, being a good person, a role model. I mean, all of that, it's a lot of pressure to have as a child.
absolutely. I didn't see that, right, at the
Right.
time,
Right. Because
but
we
that's
normalize as you
exactly
go through, that's all you knew, so it seems normal. You don't have a kind of perspective, I think, as a child.
right, exactly.
So why don't we focus on the POTS a little more? Can you tell us kind of, in the framework of all that stuff that was going on, seemingly endlessly, when did the POTS start and how did that become, a diagnosis, that you had?
So, I was in college and I was just for context, I was diagnosed with fibromyalgia when I was 18. And I had, even before that, I started seeing in high school a specialist who he was a psychologist and he worked specifically with children who had chronic health issues. And I had been seeing him, I had been going to physical therapy for the fibromyalgia, and I was treating everything the way that I had been told to. And so I had started to learn how to live with some of these symptoms I had been having. And I felt pretty good about it. I was entering my sophomore year of college. I got my own apartment. I'm sorry, it was my junior year of college that I was entering. I got my own apartment. I was so excited about it. And I started having this shortness of breath almost. And it felt like I just couldn't take a deep enough breath. And I was a little concerned about it. I didn't have a choice. I had to go to class, I had to make good grades, and I really didn't want to tell my parents I had anything else going on because I was afraid I was going to have to drop out of college and move home and all of that. And I was there on a full tuition scholarship. I was in the honors program. I had these standards that I had to meet.
Of course,
And
of course you were.
yeah.
Of course you were in honors.
Oh, I was pre-med for psychiatry. I was gonna become a doctor. So
Uh,
I was,
You
so
got
I
you
had all
dodged
of
a
this
bullet
going
there.
on. I'm sorry?
You dodged a bullet there. Just saying.
Right. Well, I won't even go down that rabbit hole. We'll save
Yeah.
that for another day. But I remember having all this sensation, and then it was like I couldn't focus on anything. The brain fog was so overwhelming. I
Mhm.
couldn't even watch TV. I just remember trying to watch TV and I didn't know what I was watching. I could not
Mhm.
comprehend anything.
Mhm.
And then it became, I was struggling to use the bathroom. I would go to the bathroom and it's like I couldn't concentrate enough to contract my bladder to
Mhm.
empty itself.
Mhm.
And that's when I started wondering what was going on. I was on
Mhm.
the toilet and my legs would go numb because I was sitting there
Mhm.
for so long. But I still wasn't ready to tell anyone because I was scared about what would happen. And I just lived with this fear and this anxiety. And then it got really bad. And I was not able to do much. I started ordering food to my apartment because I felt like I couldn't get up and long enough to make a meal in the kitchen or even go grocery shopping. And I could open the front door from my couch. So I lived on my couch, and it was like
Mhm.
I lived between the couch and the bathroom. I'm not going to class except for when I absolutely had to show up to take an exam.
Mhm.
And it was
Wow.
really scary. I lost all the strength that I had. Like, I went from being a superstar athlete to 10 bags of garbage piling up in my kitchen because I did not have the strength to make it to the dumpster. And that's just the unfortunate reality. It was a really dark time in my life. And it just continued to get darker until I couldn't take care of myself. And
Chelsea, I
I was,
just wanna say that's
Mhm.
terrifying.
Yeah.
I mean, just how alone it sounds like you probably felt and trapped and scared, and that's awful.
And that you didn't feel like you could tell anybody.
Yeah.
And what's really ironic about that is if you had told a doctor all of these things, they would be confused.
Mhm.
They
Oh, I
wouldn't they
tried.
wouldn't know what to make of it
Mhm.
either. And so
Yeah.
it's just doubly,
Mhm.
doubly horrifying and
Mhm.
bewildering.
Yeah, right. Because 'cause you're so scared and trapped and all of these confusing things, and then you go to the specialist or the person that's supposed to help you, the professional, and if they're as equally as confused, then the terror just goes through the roof.
Yeah.
And that's exactly what happened to me. There was one time when I was at college that I ended up going to the hospital because I was so concerned about what was happening. No answers. I was even more confused and alone and scared, and
Mhm.
eventually had to leave college, move home, and I ended up going to the hospital again and same thing. And it wasn't until and I was having fainting spells during this time. I actually cracked my head open, had an uncontrollable seizure.
Oh, geez.
I did not tell anyone the truth about anything. My parents didn't know I was fainting. I
Gosh.
made up a story about how I split my head open because this is sounds terrible, but I was so scared to death. Like, I thought my life was gonna be over.
What did you think would happen if you told your parents?
Well, either they weren't gonna believe me or
Mm,
they were gonna believe me, and my life would be ruined. I'd have to move home from school. I would have to leave my friends. I
mm,
wasn't going to be able to graduate and do all the things. I was coping a lot with substances, and I had that whole life,
mm,
of that was complete darkness. And I was afraid that I wasn't going to have those coping tools anymore. If I
mhm,
moved back in with my parents, I couldn't keep
mhm,
doing that stuff. There was so much fear. I just could not imagine going back to my parents' house. Like, I wanted to leave their house forever. I'm like, I turn 18 and you never have to see me ever again.
Yeah.
mm.
And I didn't want to be treated like a child either, you know?
Yeah, right.
You had this tremendous drive to succeed, be successful, be strong and smart and everything. And this was completely undermining that, taking like literally everything. You couldn't think, you couldn't pee, couldn't move, you couldn't cook. I mean, couldn't study. It's just, it's astounding that that can happen. And then go to a doctor, and doctors are like, we don't know. We know,
Mhm,
physically you look fine. Your tests are normal, right? Is that
mhm,
what happened?
Yeah, that's exactly what happened. And it wasn't until so I moved home from college. I'm living with my parents. There was one morning I got up to go to the bathroom and I could not feel my legs. And I
oh,
had to like use my arms to get to the bathroom.
Hmm.
no.
And I wasn't at home. I was at my friend's house because I still tried to live a normal life. And I called my mom and she said, "We're going to the doctor." So at this point, God love my pediatrician. He was amazing. But I went there and they're doing everything they can in the office. And my heart rate and blood pressure were just off the charts. They could not figure out what was going on. Nothing was coming down. They sent me to the children's hospital and I was there for 3 days and they ran every type of test they could. Everything was normal. And they came up with, and at this point in time, like I had a team of doctors already. Like I had a rheumatologist and a neurologist and all these pediatric doctors at the pediatric hospital, the children's hospital. They all came together and they decided, okay, you have dysautonomia. And they ordered me to go to physical therapy 4 days a week. Go to physical therapy. But the problem at physical therapy was I wasn't allowed to get off the table because my resting heart rate never went below 100.
Mm.
And so they were afraid to do anything with me. So they sent me to a cardiologist. And then that's when they did a tilt table test. They ended up giving me the POTS diagnosis. And I was sent to the pediatric pain rehab program at the Cleveland Clinic.
Mm.
So we spent 3 weeks there seeing all of their team of people. And that's when I started making a little bit of progress.
Did that fit for you, that conceptualization of the autonomic nervous system being haywire, basically? Did the POTS thing, did it make sense to you? Did you say, oh, that's what I have, and everyone agreed? Is that what happened? That's what you had? I mean, obviously, it could certainly that could explain the dizziness, the rapid heart rate, but it's not
Sure.
explaining why you can't think straight, or, why you have
Right.
zero energy. Anyway, so did it? It must have felt like there was at least some hope or some explanation that made sense to you. Is that correct? Or
Yes. So and this happened every time I was given a label. It was like, oh my gosh, I know what's wrong with me. But the problem was, and there was always a period of like relief and hope with that. But then the problem was, I would do what they told me to do, and I would only get so much better. And
Mhm.
then I would end up back in the same position. So it was very confusing.
and what
Mhm.
were they telling you to do? What was what
It
was
was go to see a therapist, do a physical therapy, exercise, eat healthy, change your lifestyle, all
Mhm.
of these types of things. And there were things that I'm not saying none of that worked. Everything helped,
Mhm.
but it only got me so far.
Mhm.
And one of the things during this time period when I was diagnosed with POTS is I attempted my first stint at sobriety and eliminated substances from my life. And that process of recovery really helped me a lot. There's so many things that I was doing at the time that helped me, which now I understand, I feel like is creating safety in my life. But I didn't understand why, like when things were offering relief, why it was actually helping. And then when
Like,
symptoms,
what's an example of that?
so of what would an example of
Of
what?
what would offer relief of like, what was your perception of why it helped, but why now, looking back, do you think it actually helped?
Sure. So I thought going to physical therapy was strengthening my muscles. And that's what they told me I needed to do to feel better.
Mhm.
And, I'm a young person at this time. I don't really know a whole lot about anything. I'm just taking everyone at their word. And my mind is, I want to go back to college and move back out of my parents' house and have my own life and do like, so whatever, if you all tell me that's going to work, I'm going to do it. And so I thought I was just going through the checklist of the things that were helping me. But now I understand, like, when I went to physical therapy, the only thing I had to worry about was being at physical therapy. And I had someone that was offering me this compassion and
Mhm.
understanding, and they had a solution for me.
Mhm.
And I completely believed in that. And how much does that do for the nervous system
Mhm.
when you're in the presence of someone who has a solution, they're listening to you, and you don't have to worry about the stress of everything going on outside
Mhm.
of there.
Mhm.
So you go to the Cleveland Clinic and you get a physical therapist and you go into sobriety. So you're doing a lot of great positive things for yourself. How much better did you get? And then what happened then? Did some
Yeah.
symptoms still persist or did new ones start?
So I go to the Cleveland Clinic. The Cleveland Clinic was incredible for so many reasons. Was on a very strict routine and I didn't have to worry about anything there. Again, I was just all I had to do was focus on myself. And we had occupational therapy, recreational therapy. They taught us about aromatherapy. We did yoga together. We practiced mindfulness. We saw a therapist and I could tell this therapist anything that I absolutely wanted to about things that I'd never told anyone before. And I was able to like let go of all these secrets that I had. And for this person to tell me, like, I understand why you're suffering so much and we're going to work through this together. And so through that process, I got so much better. And I left, and then I had to face life again. And getting a job and going back to school, and all these responsibilities came back into my life. And so this period of that I was feeling better didn't last too long before I started having a complete mental health crisis is what happened.
Mhm. And
And I
what did
ended
that
up
look like? So you had been having a little bit more physical symptoms of the weakness and dizziness and shortness of breath, the fast heart rate. But now, and a lot of those symptoms had gotten better with all of this great work. But now you're back in life, and now you're having a mental health crisis.
yes. So I can't believe I haven't cried yet because this period of my life was so dark. Like the being in the hospital, not knowing what's wrong, and then
Gosh.
getting better and thinking, "Oh my gosh, like I can function. I can
Mhm.
do some normal things. Like I can brush my teeth without having to like worry about it." And I found a job that I was really excited about. And then I was on my way to this job and I was completely terrified that I was going to hurt myself. And I called my mom and she came and rescued me, take me to the hospital, had a psych eval. I didn't tell anyone about all the symptoms leading up to this, but I was having hallucinations. I was hearing
Mhm.
voices. I was panic attacks, just full on anxiety. And I, again, was scared to tell anyone. I didn't want to be locked up in a psych ward. It was so weird though, because it was like, I didn't want to hurt myself or someone else, but I couldn't control the thoughts that were happening.
Mhm.
I was having these intrusive thoughts. Like I was still going to physical therapy and I would be in doing the recumbent bike and like, maybe exercising my arms or something. And I would just start visualizing all this equipment coming to life and like
Mm.
murdering people.
Mhm.
Crazy, like what I thought was complete and like I'm legitimately going insane, but I can't tell anyone this because they will think I'm going insane and then I'll be locked up in an insane asylum
Mhm.
and I'm just getting my life back.
Oh my gosh.
So that's where I ended up in the hospital again for the mental health stuff.
Mhm.
And that was the next set of what is going on now. It was
Yeah.
constantly there used to be a show on TLC called Mystery Diagnosis, and I felt like I was just a walking
Mhm.
mystery diagnosis.
Mhm.
You were. You were. And it's amazing how when you think of it from a brain point of view, the brain's job is to alert us to danger. And starting as a child, there was danger in your life. We don't know the extent of it and some of the other things you haven't talked about yet. You mentioned secrets, etc. So there's stuff going on, and your brain kept giving you different symptoms, and a lot of they were all physical symptoms to start with. When you got to college, it was like you're going to make it. You're going to go to all the classes. You're going to get straight A's and be an athlete. And your brain's like, no, you're not. You're not getting out of the apartment. You can't be, you can't think, you can't walk, you can't stand up. And then you got treatment for that. And then your brain's like, oh, you're going to work. You're going to go get a job. We're going to give you like severe anxiety, panic attacks, hallucinations, suicidal ideation, strong, right? Incredibly strong and scary symptoms that really take you down. I mean, it's incredible the power of the brain to do that and to find things that'll really scare you so much that you can't even tell anybody.
Mm-hmm.
That I think that was where so much of the darkness I experienced and the despair was because I felt so alone and I really truly felt like I couldn't tell anybody.
And then what happened? We want to hear about it.
So,
Can you get to something positive here?
yeah. So, this continued for years, by the way. I was only,
My God.
Oh gosh, Chelsea.
I'm 21 at this point, and it was just on and on and on. I'm telling you, it was literally, I mean, it was the bladder symptoms. It was well, this sounds like IC. And it
Mhm.
was, I had cystic acne all over my face. I had the IBS symptoms. They were sending me to endocrinologists and everywhere. Eventually, what happened is I stopped going to the doctor. So I'm 26. I'm kicked off my parents' health insurance. They're not paying for everything anymore. So at this point, I was really motivated
Wow.
to not be sick
Hmm.
because I'm on my own. And this is when a turning point happened. So at this point in time, I was fully sober because I kind of got sober, but then I was like, I don't think I'm ready to completely give that up. Like, I have to have some escape from all this hell that I'm going through. But eventually, I was 22 when I got completely sober. That helped tremendously. And I committed to a program of recovery where it was all about mindfulness, practicing meditation, accepting things. That acceptance piece was really, really big for me.
Mhm.
And, I had been going to I didn't even talk about the support group that they claimed to be a support group, but it really just made me feel worse about myself. I eventually stopped going because all these grown women who were in their 60s and lived their whole life were complaining about how horrible their life is. And
Mhm.
I made a decision. I am not going to be that person.
Mm.
I refuse. You're telling me, like, I'm never going to graduate college and be able to move out of my parents' basement and have a job and pay my bill. Like, if that's what you're telling me, I don't want any part of this because
Mhm.
that's not going to be my life. I was like, I
Mhm.
don't know how I'm going to figure it out, but I'm going to figure it out. And accepting where I'm at, taking responsibility, letting go of any sense of a victim really pushed me in the direction I needed to be. It didn't solve everything, right? But it it kept me moving in the right direction. I changed my mindset about things. And finally, after 8 years, I was at the point where I was graduating college finally with my bachelor's degree after 8 years. I tried to go every semester and I would go until I couldn't go and then I would have to leave. And then I'd go, but I was just, I mean, I won't even go down there. But my last semester, I'm feeling the pressure. I have to graduate. Like, I've been in college for 8 years and I don't even have a degree yet. And I start having all these cognitive symptoms. I'm studying Spanish at this point because there's nothing else left for me. Like, all the degrees I tried to pursue, my health took me out of it. I've been learning Spanish since kindergarten. So I was like, well, surely I can at least get a degree in Spanish. So, but I couldn't speak Spanish anymore. And I begged my professor to pass me. And I end up back at the neurologist and she told me, she's like, you got to get off this medication. And again, I took the ownership of that and was like, I'm going to get off this medication. I've been on it for years. And when I started taking ownership of things, I started getting a little bit better. Symptoms didn't go away completely, but I was really motivated not to be sick because at this point I had to move out of my parents' house. They were leaving town. They were moving away. So it was like, okay, I got to get my own place. I have to pay my own bills. I got to get this job and I have to find a way to be successful. I don't have another, like, it's do or die time. We got to figure this out. I would take, a few months of feeling like everything's going good, and then I would have symptoms, but I wouldn't go to the doctor. Like, these people have nothing to offer me at this point. I'm like,
True.
and I don't have money to spend on it.
Yeah.
So then that's when I went into the acupuncture and the whole alternative scene. I eliminated every single synthetic fragrance from my house. I was making my own dishwashing pods and makeup and got into essential oils. I'm like, this is going to solve all my problems. And we know how that goes. It's like, okay, it might help a little bit, but so I was managing until I discovered the mind body approach and my entire life changed.
Wow.
Awesome.
So
Amazing.
what's amazing is that in a way, the thing that caused you to go down was putting so much pressure on yourself, trying to be perfect, trying to be everything to everybody, despite a lot of issues that were going on, and you couldn't admit to having a problem. Couldn't. But
Mm-hmm.
the thing that actually saved you was the strength that you had, the strength to say, I'm doing it myself. And the doctors, why should I go? They're not helping me.
Mm-hmm.
And then trying the alternative route, that's not helping either.
Mm-hmm.
Finding the strength within you to say, I'm sick and tired of being sick and tired. And you kept searching. You didn't stop searching.
Right. And at a certain point, like, I gave up. I'm like, stop sending me. I mean, I took blue algae supplements. I mean, the crazy things we do because we're so desperate. And people would send me stuff all the time because I was known as the sick girl.
Yeah.
Chelsea's just the sick girl. Anyone can, like, my, grandmother sent me chili pepper capsules to take because she heard it helps chronic pain. And I stopped doing most of that stuff. I stopped seeking answers and solutions, and I just accepted, okay, I'm going to be suffering, but I'm not going to let it control my life. So
Mm.
I stopped complaining. I stopped talking about my symptoms. I stopped doing because it wasn't getting me anywhere. At this point, I'm married. I'm a
Mm,
stepmom. I
mm,
have a full-time job, a
mhm,
successful career.
mhm,
I'm doing all the things. I'm still suffering, mind you. I'm literally
mhm,
suffering, feel like I'm dying inside the majority of the time, but I'm able to just keep moving. And
mhm,
then my sister recommended a book and another book, and it was on I wasn't looking to heal at this point, but these books were about the connection between the mind and the body and the role that the brain is playing.
mhm.
So,
And when I got the education, it's like all those little neurons that were firing over the years when I would practice mindfulness or meditate or whatever, all of that synced up once I understood the science.
So, Howard, I would imagine that you've seen many, many, many patients with these constellation of symptoms, as
yeah.
have I, and unexplainable brain fog and weakness, shortness of breath, dizziness, GI dysfunction, pelvic pain, bladder symptoms,
Yeah.
weakness, fatigue, and all of that. And that constellation of how you had said before, Howard, a syndrome is sort of a constellation of symptoms put together. So with POTS, it's this constellation of symptoms that often includes lots of those different symptoms and often related with standing up specifically or that postural, that position change that elicits those sensations.
Right. It's really funny that how medicine just really needs to categorize things. And it's really hard. Like, that's the whole Chelsea story. It's really hard to say, I've got, these 20 different things. Tell me what's wrong. And they go, yeah, right. Well, if we look at the dizziness with standing, we can call that POTS. If we look at the diarrhea and the constipation and the bloating, we'll call that irritable bowel. If we look at the pain all over, we'll call that fibromyalgia. If we look at the brain fog, we'll call that, I don't know. We don't even have a name.
Yeah.
We
Right.
don't really have we don't have a syndrome for that hardly. But that's the thing about these, neuroplastic symptoms, is that they tend to coalesce. And
Mhm.
obviously, and that's how we know, not to mention the anxiety, the panic, the hallucinations, suicidal ideation. That's all part of it too.
Mhm.
But that, of course, then that fits into the category of psychiatric illness. And you go down that path, and people are being told that there's something wrong with their brain, that they
Mhm.
have these things that they can manage but never recover from.
Mhm.
But if we do focus on the POTS part of it, I think it's really fascinating to see that, because we see that, it was a really great study from 2022 where they took people with POTS and they had them think about it and talk about it, and their heart rate started to go up just talking about it. The anticipation, the fear of standing, the fear of the symptoms were so great that their autonomic nervous system started kicking in, and they went into this kind of fight or flight. That's why it's tachycardia. Your sympathetic nervous system causes tachycardia, can cause
Mhm.
the bladder dysfunction, can cause the GI dysfunction, all
Mhm.
that stuff is happening, but the autonomic nervous system is controlled by the brain, and that
Yeah.
fear hypervigilant response. And they measured that, and it's really prominent in these folks.
Mhm. Yeah, there was another study where they did a tilt table test, and they told the patients, the participants, that they were going to tilt the table 30 seconds before they actually tilted the table, and found that their heart rate went up, and they actually had the changes to diagnose POTS without actually having even tilted the table yet, just through expectation and anticipation.
Amazing, amazing. And, that's one of the things, that we commonly do with people. Just simply have someone sitting down, ask them, close their eyes, imagine standing up. And frequently they'll get dizzy, feeling, the fast heart rate, but also feeling dizzy, because the brain can produce dizziness, and the brain
Mhm.
can produce a tachycardia. So the brain can produce this whole thing. But what are they being told about the,
Mm.
you know,
Mhm.
you look at the medical kind of treatment? Have you looked into that?
How it makes sense that POTS is neuroplastic or brain generated rather than due to some sort of underlying structural problem in the body. And I see patients all the time, as I have a particular focus with long COVID, but patients are told all the time they have dysautonomia, and often patients take that to mean, well, there's something wrong with me. Like I'm injured or damaged because I have dysautonomia or have POTS. But really, dysautonomia is really that the nervous system is generating symptoms that don't serve us. That's really what it is. And it's really about our brain perceiving danger. So being stuck in the sympathetic or the fight or flight or freeze state, then it's the downstream signals that are not serving us. So if we look at this diagnosis of POTS, and the reason we give diagnoses really is to help people. Like, that's why we want to give a diagnosis. Well, you have strep throat. Well, now I know to give you penicillin. But there's so many diagnoses that are these sort of syndrome disorders that all they're doing really is categorizing and describing the symptoms rather than really giving people a way to heal. But so if we look at POTS, and again, why does it make sense that this is brain and nervous system generated rather than structural problem in the body? Is 94% of the people who are diagnosed with POTS are women. Um, yeah, is there some sort of underlying genetic hormonal issue that's associated? Nothing that's found, but So that's one indicator. Why do women get it way more than men? The mean age is 21, plus or minus 12 years. So if this is an underlying structural damage to the nervous system, why is it not elderly people who are frail and sick? Why are they not the demographic of people who get it? 93% of people who get it are white, actually. And it has comorbid disorders, just like we were talking about with migraines and IBS. It's also often part of the diagnosis of EDS or MCAS, vasovagal syncope. All of these different symptoms often travel with the diagnosis of POTS, long COVID, for instance, CFS. So again, how do we look at everything, all of these symptoms? System is not functioning in the way that we're supposed to function because we're stuck in this sympathetic drive. But again, it doesn't make sense that it's only about some underlying structural problem with, the brain, the nervous system, the cardiovascular system, but really it's about sort of the threat response.
Well, when you put it that way, it makes it seem obvious. We know there's no damage in the heart. We know the heart's normal.
Right.
We know that when your heart rate rises, you get more blood going to the brain. You're pumping more blood. Your heart rate's going faster. And we know that the blood pressure is not dropping. So there's no reason for not enough blood going to the brain. This idea. And so it just doesn't make sense mechanistically that
Yeah.
that the dizziness is due to something to do with the heart or the blood pressure or the vessels. What it has to do with is the brain generated sensation of dizziness. And we know that happens because you can just imagine standing up, you get dizzy. So it's pretty obvious. But people are being told that they have, not enough fluids. They're not hydrated enough. So they need to drink more. They need to wear compression stockings in the legs, or
And
they
eat
need
salt.
what?
And eat salt.
Yeah, eat salt.
And what that does is it increases the amount of volume of fluid in our whole system.
Right. And it's not actually the problem.
Yeah, right.
So if those things work, they work on a placebo basis. They work because people are feeling better, that they're doing something, that they're helping themselves. But it couldn't be clearer. And why? And we've talked about this a lot, you and I, and we're going to talk about it endlessly. But I think we say, well, why are women more likely to get these things? But when you look at Chelsea, and I would love to hear actually more about maybe your early life, Chelsea. But you see a young woman who's trying to be so good, so perfect, so great, firstborn. Got to be a lot of pressure on yourself, but also things going on where you didn't feel safe in your life, most likely. And girls, teenagers, women tend to have higher rates of emotional abuse, higher rates of sexual assault, higher rates of pressure on themselves to help others, to be the good person, to be self-silencing and not complain like Chelsea wasn't. You weren't going to complain.
Yeah, right.
And I just
Powerless in life.
powerlessness. I
Allowed to
think
express anger and stand up for yourself.
exactly. And so I really think this is amazing hearing even part of your story, Chelsea, but I bet there's a lot more underneath, because you talked about secrets, you talked about using substances, those things happen in the setting of things that are happening that make people feel unsafe.
Yeah, I can speak to that. Do you want me to talk a little
Yeah.
bit about that?
Yeah.
Well, I went through this period of time where when I understood the science, I got really angry
Mm.
and really resentful at the medical field and these doctors. And I mean, even after I got my tonsils out, I got my tonsils out, I think I was 6 years old, and I kept having sore throats, and no one asked me about like what school was like,
Mm.
or
Mm.
if I, was afraid to speak up for myself,
Mhm.
or, these different types of emotional things. And chances are, I'll be honest, if they did ask me that, I probably wouldn't have told the truth, because my mom is in the room with me,
Mhm.
and I don't want her to know that I'm being bullied at school.
Mhm.
because I don't want to be like, it's already hard enough to deal with the bullying. And then my mom is an anxious mother
Mm.
and she's going to be freaked out about that. And
Mhm.
I already feel very sheltered and I don't want her to be even more of like a helicopter mom.
So even
And
at 6 years old, more or less, you were taking care of your mother and her emotional state in some ways.
100%, she had a 4-year-old and a 2-year-old, and she,
Mhm.
I couldn't be a bother to her. She was
Yeah.
too busy with them. I had to take care of myself. I had to make her life easier. I didn't want to upset
Mhm.
her,
Mm.
give her my problems. And I I think about it, it's amazing once you have the understanding how things just start to click and make sense.
Yeah, right. I think it's really clear once you really stand back and look at the whole picture. It usually is quite obvious of all the pieces falling into place.
Mhm.
Was there
Definitely.
were there other things that you wanted to mention growing up aside from kind
Sure.
of the family and the medical? Were there other things or
Well, I grew up in you know, a nice neighborhood. My dad had a really good job. My mom was a stay-at-home mom. I went to private school for 13 years. I went to school with people who had money. They always had the newest and latest and greatest everything. My parents were like, my dad drove his Camry until it had 400,000 miles on it. And, but I was always going to school with these kids who had all this amazing stuff. And my parents didn't buy me that stuff. And I didn't get to go to, the vacation home or the lake house on the weekends and things like that. So I felt very much less than from a
Mm,
very young age. And I just always remember having this anxiety. And I struggled in school, learning to read,
mhm,
learning math. I was really scared of what people were going to think of me if I checked out a library book that was not as advanced as everyone else. So I would check out very advanced books from the library. So people thought that I actually
mm,
knew how to read when I really didn't know how to read. And then, it only took one time in the 3rd grade when I failed a times table test and they told me I had to sit out in the hallway while everyone else moved up to the next level and I had to sit by myself out there. I was like, this is humiliating. I'm going to
mhm,
figure out how to cheat so I don't have to experience that again. So then I
mhm,
start cheating on tests and then I have that guilt and shame
mhm, mhm.
and you can see where this is going.
It's hard
yeah.
to be a human.
Yeah.
It's so
Yeah.
sad. That's just so sad.
Mhm,
I mean, just seeing this little waif, worried about what her mom's gonna think, worried about what the other kids are gonna think, keeping the secret inside, feeling like she's less than, not smart enough, not good enough, has to put on this face and put on this persona of being super kid. It's just, oh God, it's just so sad.
Yeah, it
yeah,
was a lot and I could tell stories for days. Don't we all? Can't we all?
I
I mean,
know.
it's just there's so much and then
It's
this incident happened
oh,
where
yeah.
I just felt like I couldn't trust my parents or the principal or the teacher. And
Mm,
so then I'm like, okay, well, if I can't trust them,
mhm,
who can I trust? And that's when you thought I hid things before. That's when I was like, no one is going to know anything. I'm going to make it my job to wear this mask and I'm going to be the best actress you
mhm,
have ever seen because you're not going to know anything about me.
mhm.
And I lived that way for a really long time.
Wow, amazing.
And the person that you couldn't hide from was yourself,
Yep.
right? The person you couldn't hide from was that part of you that loves you and cares about you and worries about you and knows what you're going through and knows that it's all, false or fake or put on and all that stuff. And
Mhm.
so of course you're going to get migraine. Of course you're going to get fatigue. Of course you're going to get irritable. Of course you're going to get POTS. Of course you're going to get anxiety and can't think straight. You can't, my God, that's so obvious.
So
It's
Chelsea,
so obvious.
what was the were the big pieces of information that made a difference? Like you had been seeing a therapist, doing all of these great things, like when you were at the Cleveland Clinic, had gotten so much better in that setting. So what are the pieces of information of the mind body medicine that really was different than what you had before?
Yeah, we've been waiting to hear.
Yes. So I think, first of all, understanding that the brain can generate symptoms was huge. And it kind of actually made a little bit of sense when I started thinking about it. Like, I
Mhm.
was diagnosed with this thing called central pain processing disorder.
Mhm.
So I started thinking back to these different situations and experiences. And then I started thinking about the placebo effect and the nocebo effect and how I was diagnosed with scoliosis when I was in the 7th grade. Never experienced back pain until I had a doctor and an x-ray that pointed out that I have this curve in my spine. And then I had back pain.
Wow.
And
Amazing.
so I would have these started remembering some of these experiences I had.
Mhm.
Um, And then I even remembered I had a chiropractor one time because I asked him about, I always felt this need to crack my neck. And he said, well, the reason why you're cracking your neck is because it releases these feel good hormones and these endorphins in your brain. And you get this sense of relief when you do that. And I'm like, hmm, okay. So I started understanding how this stress response worked, how the relaxation response worked. And then I understood how the brain was actually learning these symptoms all along. And
Mhm.
every time that I told someone, oh, my body can't regulate my body temperature, it's reinforcing that symptom. Oh, I faint sometimes. Oh, every time I stand up, I get dizzy.
Mhm.
Well, what is that doing? And so when I understood that, it's almost like everything connected
Mhm.
and it clicked. And these little moments in time, because I would wonder how come I can do this today and tomorrow I'm completely unable to do anything, or I have this pounding migraine, or it didn't make sense to me. And then when I
Mhm.
had the science, it all made sense.
Yeah, that inconsistency can be such a powerful piece of the information. And then what were
Absolutely.
the tools? So you understand the science that this is about signals in the brain to learn neural circuits that are stuck in place. And then through that, we then create this life around us that just reinforces us being sick with all these people sending you supplements and sending you um, answers because you're the sick girl and going to doctors all the time and avoiding things and all of this whole big web that's really woven that keeps your brain in this danger response.
So, one of the biggest things was I let go of everything that I had been using to fix myself. So,
Mm,
like, I had a little headache pillow and I would lay on it when I had a headache because I thought it made me feel better. I
you
stopped
probably
using it.
did.
I had this contraption that hung over the door that I would like put my neck in to like stretch out my spine, and I stopped using it. I stopped relying on the chiropractor and the massage therapist because I developed a very strong belief that there was nothing quote unquote wrong with me.
Mm,
And if my brain is capable of producing this vast, array of symptoms, it is capable of getting me out of this situation. And it didn't matter what was going on. I kept coming back to this belief and trust in my mind, in my body, and the power of the brain.
So,
And
you bought into this so totally
completely.
that it empowered yourself to stop doing a bunch of things that people thought would be helpful or you had thought were helpful. You stopped doing that. You also, then what did you do kind of on the positive side to say, hey, what am I going to do that will, move me forward? What were
Yes.
kinds of things?
I had to change the relationship I had with the symptoms.
Mhm.
And rather than being afraid of them or trying to fix them or getting frustrated with them, I actually kind of embraced them and I thanked them.
Mm.
And I couldn't rewire the brain and change these pathways if I didn't have symptoms.
Mhm.
So, although I'm telling you, this was a mental game. This was a tug of war at times of really leaning into this new belief that I had. It was not a smooth sailing, like I'm all on board 110% of the time. It was very much it was a battle to
Mhm.
really change my mindset about that. But when I could shift that relationship with the symptoms and I started being with them,
Mhm.
allowing them to be there, practicing things like somatic tracking and noticing the sensation in the body. And I kind of treated everything like an experiment rather than a formula and a recipe that I have to do this in order to get my symptoms to go away. It was more just, I wonder what will happen if I just observe what's happening right now.
Mhm.
And that curiosity and playfulness. Like, can I really run a mile? Let's just do it and see what happens. And the more fun I had with it, the better things got for me. And I also, that emotional piece, that was that was probably more challenging than the mental piece, if I'm being honest.
Mhm.
So I want to get to the emotional piece in a second, but you were doing this on your own, basically. You were just like reading
Ye-
books and saying, "Here's what you can do. You can be curious. You can be observant. You can be playful. You can be empowered." And you're like, "Let me do that." Is that what you're saying?
Yes, exactly. Well, and I'm like, well, over all these years, I've had all these mentors, these physical therapists, telling me to do this and I do it and I, you know, succeed as best as I can with that type of approach. And I would go to therapy and I would take the recommendations of my therapist. And I said, whatever the author is saying in this book, I'm going to do exactly what they say and just see what happens. And I really had to let go of all my existing thoughts, feelings, and beliefs. I questioned everything I knew to be true about everything in this world. I just set it to the side and I just surrendered to whatever these authors were telling me and teaching me in these books. And I trusted the process.
Well,
I
you
just
always were a good student. I got,
good student.
That comes in handy. Amazing.
Well,
Awesome.
what about the emotional thing? What you were alluded to that. What
Yeah.
on that level?
Well, that was a really hard thing that for me to wrap my mind around, but it made sense, right? Especially looking back in childhood, I was the don't talk back. You say this at dinner and you go to your room type of
Mhm.
situation. And so I was trained not to express emotion and then it was like, well, if I do express my emotion, I'm alone with my emotion anyway. Like I might as well just be alone with the emotion and not say anything.
Mm.
And so I bottled everything over the years. I actually, in college, someone told me one time, they were like, I don't think I've ever seen you cry. Like, you've never even talked about crying ever. And I thought about it and I'm like, wow, yeah, I haven't cried in years. When I got sober, I started experiencing some more emotion, but emotion was dangerous. I
Mhm.
was taught that emotion was dangerous in this recovery community because if I was, allowed my anger to get the best of me, I'd probably go drink and
Mm.
make bad decisions.
Mm.
And to be able to just allow myself to be like, you know what? I'm allowed to be angry
Yeah.
and
Right.
allow myself to experience that and express that. Not to say like I can go, cuss someone out and think that that's going to serve me and allow me to keep my job and, whatever. But it's finding that healthy way to just
Mhm.
notice, even just beginning to have that awareness. This is upsetting.
Yeah, right. And anger is for ourself. Healthy
Hmm.
communication and boundary setting is for other people. But your
Right.
emotions, you deserve to express and feel your emotions. That's amazing.
Yeah. So what I did was I started like, if I did have a symptom that seemingly came out of nowhere, I just asked myself, like, what was going on
Mm.
leading up to that? You know, it's probably my husband called and last minute said he had to go out of town. And now I'm left with the kids and the dogs and all that. Oh, that, okay, that makes sense.
Yeah, right.
And
Amazing.
then what do you do? So then are you allowed to be resentful or angry, at least to honor yourself? Like Becca said, anger is to protect us. It
Hmm.
doesn't mean you have to, tell your husband he can't go, but you know, you're allowed
Hmm.
you're allowed to be angry about it and to, you know, he owes you one, right? Or whatever.
Right. Well, no, and that was so huge for me. And just to notice how that showed up in the physical body.
Yeah. Mhm.
Any type of emotion, I started realizing that wasn't like a mental thing
Mhm.
so much as I actually experienced that in the
Yeah.
physical body.
Mhm. Right.
And sometimes just noticing that and honoring myself in that moment and giving myself space to just notice the presence
Yeah.
of an emotion, because I never even did that. I never even acknowledged any type of emotion.
Yeah. It's amazing.
Can
Oh
you
my
relate
gosh.
to that, Becca?
I can't. Yes. Oh, it's very similar. Everything that you talk about, the high achieving, getting A's, being hard on myself, bottling up my emotions, not feeling them. Yeah, it's really transformative to understand the power of our brain, connections in our body, and really step into our own empowerment. That's amazing. We should probably wrap up. This is
So
an
did you get better? What do you still have do you still have a lot of symptoms, or did they
Oh
some get
no.
better and some get worse, or just kind of catch up?
So to wrap it up, once I found the science, things really got better pretty quickly for me because again, like I had already been practicing a lot of these tools and I didn't even know
Mhm.
it. So once I found the science, everything got better pretty quickly for me. And I actually went to the eye doctor about 6 months ago, first time ever in my life. I would say I'm completely 100% healed from over 24 conditions at this point for a good 2.5 years. I'm confident in saying that. And I went to the eye doctor and I did not list a single diagnosis that I've ever been given. And I did
Awesome.
not have any medications to list. And I had no allergies to it was a blank sheet of paper. It
Wow.
was
Oh,
mind blowing.
Amazing. That is fantastic.
wow.
Well, awesome, Chelsea. Amazing story. And it's so just beautiful to see your transformation and lovely. Thank you for sharing it with us.
Thank you so much for having me.
Yeah, you're amazing. Thanks so much.
Yeah, awesome. And thank you, everybody, for joining us. We look forward to having you join us in our next episode.
I'm Howard Schubiner,
And this is Becca Kennedy. I'm Becca Kennedy.
and we are the Association for the Treatment of Neuroplastic Symptoms, one of our podcasts that I can't remember the name of it, but hopefully you do.
And this is the science behind the symptoms. Thanks so much for joining us.
There we
Until
go.
next time.
Bye now.